Good morning, I'm Alexis Del Cid in for Jessica Lovell. Welcome to the Morning Medical Update. Tiny glands, sometimes as small as a grain of rice, can end up causing big problems across your entire body. Today we're meeting a woman who lived with symptoms like muscle pain, fatigue, even brain fog. Doctors traced those problems back to her parathyroid glands. We will learn why she decided on surgery and the huge difference she noticed once one of those tiny glands was gone. Joining me today, I have two remarkable guests. We have Michelle Williams. Michelle was first treated for hyperparathyroidism. That was in 2022. And Michelle, that surgery helped you regain your ability to sing.
Yes.
Full disclosure, right before this, I said, will you sing on air? No, thank you. No one likes to be put on the spot, but I love that you can sing. You're back to your singing voice.
Yes, I am.
That must feel wonderful.
It's one of my favorite hobbies.
We also have your doctor, Dr. Aaron Buchek, a head and neck surgeon here at the University of Kansas Health System. Dr. Buchek specializes in thyroid and parathyroid disease, and you treated Michelle. We love reuniting doctors and patients, and what is so great is when we see you both come in before the show and you're hugging and saying hello. When was the last time you saw each other?
I think it's been a few months at a post-op visit, probably March, I want to say.
I don't remember the date, but it's been a few months.
Yes, yeah.
It's nice when you don't see someone for a long time. In your case, someone you like very much. You don't want to see them often.
Exactly.
When they're your patient. Michelle, 2022, I want to get to everything that you have had to walk through and fight to get through. In 2022, doctors started looking at your parathyroid, and you were already a patient because of a couple of other different health diagnoses. What were the different things that you were already being seen for here at the health system?
Well, I'm being seen for pulmonary arterial hypertension. I'm being seen here for cardiac issues, as well as rheumatoid, which is I have mixed connective tissue disease, so I'm being seen by rheumatology as well.
For an autoimmune. Now, were those conditions directly related to your parathyroid, or is that just bad luck, the hands you were dealt?
I think they are separate entities, but when you have an issue such as hyperparathyroidism and the interventions that need to take place, the other chronic problems play a role in how it's handled, how it's taken care of.
And we're going to get to that in a moment with how the doctors have a collaboration of how they care for you. When it comes to your parathyroid, what was the first sign that doctors noticed that you might have a problem with your parathyroid glands?
It was a little tricky because with the mixed connective tissue disease, a lot of the issues or the symptoms were similar, but they were starting to get worse, such as fatigue. With the mixed connective tissue disease, I have chronic fatigue sometimes, but it was starting to get worse. So they didn't know if it was my connective tissue disease exacerbating or if it was a separate problem. So they kept watching and doing labs, and the fatigue, the muscle aches come with the mixed connective tissue disease, but they were starting to get worse. So in those symptoms getting worse, they would do blood work to see if there was anything awry in there. And in the blood work, along the normal labs that they look at for the connective tissue disease, they saw that my calcium was a little high. So at that moment, they didn't address it as a snapshot in time, but they watched it. And I think about 2 to 3 months later, they did labs again, and the calcium continued to go up. And they decided to do a parathyroid hormone test to see what those levels were, to see if they were affecting the reason why my calcium levels were going up.
I want to bring Dr. Buchek in because we do need a quick anatomy lesson. A lot of us are familiar with where the thyroid is in our necks. Can you show us where the parathyroid glands are located and what do they do in the body?
Great question. So the parathyroid glands, you have 4 of them total. And they live behind the thyroid and just a little bit off to the sides. They sort of hug the thyroid gland. But they have nothing to do with the function of the thyroid gland itself. They're just sort of next door neighbors, as I like to say.
And we have a nice picture up so we can help people understand.
And so they're normally very small. Like you shouldn't be able to see them on any sort of imaging study. You can see them during surgery most of the time, but they're very small. Their only job is really to control calcium in the body. And so when the normally when the calcium levels are low in the body, the parathyroid glands produce more parathyroid hormone to bring the calcium levels up in the bloodstream, and vice versa. If it's high, the parathyroid levels should be low. That's physiologic.
And so we have an illustration showing Michelle's diagnosis and what hyperparathyroidism looks like. I'm always amazed that you can look at these images. Well, first, this is a great drawing or a great illustration of what a normal parathyroid gland would look like, and then the enlarged ones, right?
Yes, yeah. On the left-hand side, they're all relatively the same size. They're pretty small, and on the right, you can see that one of them is substantially more enlarged than the others, and that is the most common problem when you have a problem with the parathyroid glands, is that one of them is the issue, and it gets big and overproduces parathyroid hormone.
And is it always that high calcium scores are what red flag that someone might have a parathyroid problem?
Generally speaking, yes. An elevated calcium, or sometimes it's just a high normal calcium, meaning like it stays on the higher end of our normal range. But classic primary hyperparathyroidism is when you have a high calcium and then you also have a high parathyroid hormone level.
Now I want to get to the scans that you shared of Michelle. This is what's always incredible, because it looks like a Rorschach test to most of us, but when we pull up these images in the monitor behind us, you're able to see, just by looking at this, what the problem was.
Yeah, so this is a cross-sectional image looking at slices across the neck, and we're scrolling down now. You can see her trachea in the middle there and the esophagus off to the left side. Her thyroid gland is right here, and behind it, there's a teeny tiny little mass on that right side that you can see. And when we first got this CT scan, that was what I would say would be our primary candidate. We thought that was the problem, and it was on that right side.
The white bubble that we see
this
moving?
small little, and we'll have a little circle here, we'll be able to see it right there.
Okay.
This bigger structure is the thyroid, and that little circle is surrounding the abnormal parathyroid gland.
And so looking at that, you knew Michelle had a big problem.
Yes, actually the diagnosis is more about the blood work than it is the imaging. The imaging we use to help us guide surgery.
Is it something you can feel if you were doing, when I go into my doctor, they're always feeling my thyroid and moving it around. You can't feel those bumps?
Unfortunately, no. It's very difficult to feel parathyroid gland because they're so deep in the neck, and they're usually fairly soft, so it's not like they stand out when you feel the neck at all.
Was surgery the only option for Michelle?
We debated about that a lot. Surgery is really the only treatment for primary hyperparathyroidism. You can treat the calcium levels in the bloodstream and the urine with medication, but it's really more of a Band-Aid than it is a true fix for the problem.
And Michelle, your other doctors, because you are seeing quite a few other doctors here at the health system, were a little worried about having surgery. What was the biggest concern about you having surgery?
My other chronic issues,
right.
My lung condition primarily, my lung and heart condition primarily, and going under surgery. So I was offered alternative treatments for the calcium, but I just kept thinking to myself, I'm already on so many medications. I didn't want to add another one that was going to be lifelong. And I think it's IV medications, but I'm not sure.
It's generally oral, but still, it's you have to take it every day. And there can be side effects from that medication as well.
Whereas you remove it, and that the problem's gone.
Solved.
And we're going to get into the topic of all of Michelle's other medications and how she handles those in a little bit later in the program. So as a team, you wound up deciding that surgery was the way to go.
Yes, and I would say it was truly a team effort, because I could tell she needed surgery, but I needed her other doctors to help clear her for surgery and make sure that it was a safe decision.
Right. And that's something that you've talked about to us, even off camera, was loving that you knew that there was a whole team of specialists helping make these choices with you. One of the side effects or the symptoms that I'd love to ask you about is brain fog, because if people haven't ever had the joy of dealing with brain fog who are watching, can you explain to them what it feels like?
I guess fog is a good word, and maybe if I give examples that might help. So I remember being in the kitchen with my son, and it's a nice sized kitchen, And I would go to the refrigerator and get something, then go to the drawer on the other side and get something. Then remember, I need to go back to the refrigerator because I forgot to get something from there. And then I had to go back to the side with the drawer to get something else. And my son is there, and he said, "Can't you just get everything at once?" And at that moment, it dawned on me, oh my gosh, okay, I can't remember to get everything at point A until I get to point B. And then I was just going back and forth. And it wasn't until he said something as benign as, "Can you just get everything at once?" I didn't realize that I wasn't even thinking things through. Or I would start a sentence and then say, okay, wait a minute, I lost my train of thought.
Brain fog is often things that your loved ones will notice first because you're not your normal sharp self. Your brain just can't contain more than one specific thought, if that, at any given time. That is so wild. How does something with your parathyroid gland affect brain fog or cause brain fog?
A lot of the symptoms are due to the calcium. It's not the actual parathyroid hormone that causes most of these symptoms, but when someone has an elevated calcium, it can affect everything in the body.
What's it doing in the brain? Is it inflaming things? Is it?
No, not necessarily. It just, and we don't fully understand that, but it just makes it difficult to think clearly. It impacts your muscles, which is why people get that muscle pain and aches. It can cause bone pain. And then the big one is the fatigue. It just really makes people so tired.
We know we're going to have a lot of questions from our viewers on this topic. We love when you send in your questions to us, and you can send them to us right now on Facebook or YouTube, or you can email the Medical News Network. We have all the ways you can connect with us in real time right now here on your screen. Michelle, I'd love to know, how did you feel mentally leading up to this surgery with so much at stake?
First, I was excited that I could get this done, and that a doctor would accept the challenge, because I know that I'm a challenge in regards to my medical issues, and maybe some might say do the others too. But I know that medically I have complex issues, and they all affect, everything affects everything else. So to find a doctor that was willing to do the surgery if we checked certain boxes to make sure that we were going to approach this as safe as we could, that was exciting to me, that we could get this done. So I was really eager to do whatever was necessary to check those, get those boxes checked.
One of the things that you also got hit with, and this is so unfair, during your recovery, you then got gout. Your gout flared up, which is just so unfair. Some people get handled such a rough deck of cards. Look at, we have a picture of your gout in the monitor there. What did gout feel like?
It's painful. You can't walk.
Oh my gosh.
Whatever, if it's affecting your ankle or your foot or your leg, you can't walk. It's just excruciating. You can't bear any weight. It feels hot or warm to the touch. Not even the sheet of your bed can touch the area. That's how painful it is.
It's kind of how people describe shingles a little bit.
Yes, I've had that too, and I would say yes.
Lucky you. So do you know, do you think the gout triggered, and I know you're not a gout expert, Dr. Bushek, but do you think, knowing your system is like a delicate chemistry set, do you think surgery might have triggered something to inflame the gout, or that
not
just something
directly, but indirectly? Because in preparation for the surgery, and anyone who's had surgery knows this, you can't eat or drink for a certain amount of time before the surgery. And the fact that I couldn't drink because I was having surgery, which is normal, a normal procedure to have. I couldn't drink, plus I was on diuretics, even though I stopped the diuretics, but I had to stop them before. But prior to that, I was taking them, so I got very dehydrated. And in getting dehydrated for no other reason but having the surgery, and those were normal things that anyone would have but would recover, I went into a gout flare.
Oh my gosh, how long did that take to clear up?
Usually about a week, but it's if you get on meds right away. You have to get on special medications just for that pretty quickly.
So if anyone's having a bad day, just think of Michelle. She still is here. She's smiling, and she got through it. She's getting through it. So you are a true testament to how people can just forge ahead. One of the things that is so important to you is your voice. We talked about that at the top of the program. And a risk of thyroid or parathyroid surgery is possible damage to the voice box, what doctors would call the larynx. Dr. Buchek, how were you able to reassure Michelle that her voice box would be okay?
Well, a big part of the surgery is basically avoiding any damage to the nerves that go to the voice box, and they run near the parathyroid glands. Most of the time, we don't have to do a lot of work around that for parathyroid surgery, but we use nerve monitoring when we operate. We're extremely careful, but as I talked to Michelle ahead of time, I mean, surgery has risk, no matter what. The risk is low, but not zero. But we were very careful and we did our best to rehab her voice afterwards, and a lot of it has to do with just letting the swelling go down and then intraoperatively just being really careful.
Yeah.
And you can hit all the notes you used to be able to hit.
Yes. Yes.
Can you go Mariah Carey high? What's that
maybe
note?
just an octave below Mariah Carey high.
We promised Michelle we would not put her on the spot, but afterwards I want to hear you belt out some notes when we're off camera. You also shared a picture of all your different medications that you were taking even before this, which adds another layer, because how often do you have to take all your meds?
Those are my morning meds.
Just the morning ones?
Yeah, those are my morning ones.
My goodness.
I take meds about 5 times a day.
And meds are expensive.
Yes.
Which brings us to another thing that Michelle has seemingly been able to take on head on, is that Michelle has started applying for grants just to help cover the costs of her medication. How expensive are your medications without the grants? So
in that handful of medications, 3 of them go to my pH meds. 3 out of that cluster.
And that's pulmonary hypertension?
Pulmonary hypertension.
Okay.
And those 3 pH meds currently that I'm on retail about $60,000 a year. I mean, $60,000 a month. $60,000 a month.
I saw Dr. Buchek take a deep breath, trying to contain her feelings about that, about how much things cost for patients. How on earth did you even learn how to write a grant? I would not know the first thing about writing a grant.
That I had to learn, but right from the beginning, anyone that's on PAH is connected with organizations that actually write the grants for you, or ask for donations, private donations, to help fund money for people like myself that have very rare diseases, PAH being one of them. So the hospital, through the doctors that handle patients with these rare diseases, and PAH in my case, they will let you know, okay, you need to call this organization, organization. They're giving out money, or the funding is open on November 1st. Start calling November 1st, and it's a first come, first serve after you apply for it.
Thank God you had a team of doctors that knew that and was able to tell you what organizations you could hook up with. That sounds like a full-time job in itself, appealing for grants and money when you're battling diseases. You're trying to actually live your life outside the hospital, and here you are. One of the things that I know you cherish outside the walls of the health system is time with your family. We have some wonderful pictures we want to pull up. Who are we looking at here in these beautiful pictures?
So we are looking at my 2 adult children, and those are my grandbabies from my 2 adult children.
So you have 4 grandbabies?
4 grandbabies.
Do you want to give anyone a shout out?
That's Oliver and Ryder. They were eating ice cream there, and my daughter-in-law Alyssa, my son, my daughter Christina.
What a beautiful family. And do you feel like you're finally back to making new memories?
Oh, absolutely.
With your family?
Absolutely.
Back to living?
Absolutely.
Back to being grandma and
That's
mom.
the purpose.
One of the other things that I know you cherish is that you're very active in your church, and you have a wonderful and large church family.
I do.
Here are some pictures of your church friends. What kind of role did this play as far as support and healing in your journey?
Oh, my faith. My faith. I have a very strong faith, and I believe that there is nothing that you get through that doesn't have a purpose to it. And that's why anytime I have an opportunity to talk about, not per se me, but just what I've been going through and the disease processes, I want to share with someone, because someone out there may be suffering with something silent. Or I know it was such a big deal for me to find out that other people had this condition too.
Right.
And that they were not just surviving, but thriving. That made a big difference to me to find that out. So between my faith in knowing that God will never leave me and continues to be with me through this journey of life, and the other part is that He has put tools, people in my life that help see me over those hurdles, makes me want to share my story more so that people don't think that they're alone handling this.
And you are doing that. You're helping people as you speak right now. You're helping people, Michelle, and so are you, Dr. Buchek. And before we get to some community questions which are coming in, one more thing I want to ask you is if you had to rattle off 3 or 4 of the most common symptoms of this specific problem with parathyroid glands, what would they be to people watching?
Fatigue, brain fog, and then just body aches. And overall, to sum it up, the most common thing I hear from patients is I just feel so much older and so much more tired than I should. And it's hard to put a finger on exactly what it feels like, but that is the common theme.
So is the question they ask then, can you test my calcium?
Well, usually by the time they get to me, that has already been done.
Yeah.
But yeah, it can be a tricky diagnosis to make because, as Michelle said, those symptoms can be from a whole host of other problems.
Just be from life.
Yeah. And a
I'm
lot
50
of people said,
and you just described half the things.
Yeah, I just thought I was getting older.
Right.
You know, I hear that all the time. And so it can be difficult to diagnose, and it can go on for years before anybody really puts the pieces together.
Man, and one thing we've learned from talking to our doctors is do not attribute it just to age, right?
Yep. Mm-hmm.
Okay, we have some questions that just came in. Alex wants to know, can the calcium imbalance caused by hyperparathyroidism cause pain in other parts of the body?
Yes, it can. It can cause, and typically the pain is more, I say sort of all over. So it's not so much like my knee hurts all the time. It's more, I have this kind of aches and pains all over my body. Some days it'll be your legs, some days it'll be your arms, but it can move all over. Yes, it can.
And that's what Michelle described at the beginning.
Mm-hmm.
Marcia asks, how common are parathyroid issues, significant enough to require treatment or surgery?
They're more common than people think. It's still a relatively uncommon problem, I would say, but I think it goes likely underdiagnosed for long periods of time. And not everybody who has this problem needs it treated either. There can be very mild forms that have no symptoms at all and don't necessarily need treatment.
Stu wants to know, what is nerve monitoring and how quickly did symptoms resolve after surgery? I'll start with the nerve monitoring. What is nerve monitoring?
Oh, yeah. So during surgery, we have to put a breathing tube down to breathe for patients while they're asleep in the operating room. And that breathing tube sits in between the vocal cords. So we can place an electrode on the breathing tube so that we can monitor the function of those nerves that go to the voice box.
And that's how you protected Michelle's singing voice. Stuart also wants to know, for Michelle, how quickly did symptoms resolve after surgery?
I remember Dr. Buchek telling me that my calcium levels would initially swing like a pendulum. And it did. She was spot on, because I think not long after, I think I was still in the hospital recovering, I started to get jittery. It felt as if I drank several cups of coffee all at once, and it was because my calcium had dropped.
Too low.
Yes, it went too low. So I was starting to feel the opposite of what I was feeling. Instead of feeling sluggish and tired all the time, now I was just nerves. And so then they gave me calcium supplements. And continued to monitor my calcium. And it went like that, less frequently, but off and on for maybe about a month or two. And then settle down.
Oh, that's nice. Jill has a great question, and this also goes in tandem with another question from our viewer, Becca. If you've only removed one parathyroid gland, will the others take over the work, or is she on medication now for that missing gland? That's the first question.
To answer that question, the other 3 should take over just fine. And actually, in Michelle's case, we ended up having to take out 2 glands. Which is part of the reason why her calcium dropped a little low temporarily, but the other 2 picked up the slack. They just needed a little bit of time. But you technically only need 1, and some people only have a half of one after surgery, depending on the problem, to be okay.
And that goes to Becca's question. Becca wants to know if you'd ever remove all the parathyroid glands as a preemptive measure if you sense there's going to be a problem in others.
We don't want to do that because you do need some parathyroid tissue in your body. Otherwise, you have extremely low calcium levels, which can be honestly worse than high calcium. So we need to make sure that folks have some parathyroid tissue in there. We can't take them out.
Michelle, does the name Patricia Millett Claybrook ring a bell?
Yes, she's my cousin.
Exactly, I know. She wrote in, "Good morning. My cousin/sister is a walking miracle." Patricia, we agree. That makes you, well, that gotcha. What does that mean to you to have these people in your corner?
Everything. Everything.
You guys can hug if you want.
Oh,
I
have such an affinity for this woman because, you know, she's being very understated, and we talked about the challenges going in that we wanted to make sure all the boxes were checked. But we had a couple of challenges a challenge or two afterwards, which I don't know if it's connected to my chronic disease or not, but it was unexpected. And
yes.
Dr. Buchek was there to hold your hand and guide you through it.
A little more than hold my hand. She just went into action.
She was right there. That's incredible. We just love that. Amy wants to know, is there an easy way to tell if a symptom, and I'm guessing the answer is no, is there an easy way to tell if a symptom is due to the problems with the parathyroid versus thyroid?
Oh, actually, yes.
Oh, okay.
Lab work is really the true
Yeah.
telltale. And it can be tricky too because low thyroid levels can also cause fatigue. Generally, the symptoms look a little bit different, but it can be tough to tell. Blood work is the easiest way to differentiate the two.
So symptoms can be similar, but blood work is the Mac Daddy that tells you what's going wrong.
Yeah.
Because the symptoms you describe are so ambiguous.
Yeah, that's the hard part, is they're very tough.
I want to ask you both for today's takeaways for this discussion. Michelle, what do you want people watching to know who didn't know about this issue before or your journey?
That you're the only person that's lived with your body your entire life. And whether you have no issues and have been living in great health, or you have chronic issues and have your highs and lows, you know when something feels more different than it should. And if you have a good team of doctors, and it's so important that it is a team effort, that you have doctors that trust you enough to say, okay, she feels something's wrong, let's look further into it. That team effort is worth your health.
Dr. Buchek?
I would just encourage patients that, especially anybody who's had some abnormal lab work in the past, it's super easy to just say, oh, that'll get better with time and write it off, but this problem does not get better on its own. So encourage people to empower them to ask, hey, can we check those labs again? Is this normal? Is there another cause for it? Because there can be other causes, but if there's no explanation, to look into this problem.
Marlene Nash has one more question for you both. I'll start with you. Michelle, have you considered writing a book to help further spread knowledge and understanding?
I have a lot of times, even writing in my journal, but I haven't gotten to the point yet where I can write without smearing it with tears. So, so maybe when I get a little bit more distant from it, I would love to.
Sometimes the most beautiful things written are when you're raw. Just raw.
So my friend told me I need to just record it.
Yes. Yes. I can name probably a dozen people off the top of my head that would go buy that book today, and many, many, many people watching. Dr. Buchek, have you considered writing a book or an article on this specific case?
Not on Michelle's specific case necessarily, but I have authored a book chapter and written some papers, but they're all in medical journals. No one would be interested in
When do
reading
you
them.
have time to write book chapters in medical
what I'm
journals? No, seriously, when do you have time for that?
Nights and weekends generally, but I haven't done it in a little while.
Wow. Well, thank you so much for joining us. Michelle, thank you for sharing your journey. This was beautiful. And thank you to our viewers for being with us today. We've loved this conversation. Have a great weekend. We will see you back here on Monday morning. Coming up Monday on the Morning Medical Update. Only 1 in 10 children has their cholesterol tested like they should, and some parents don't even know it's recommended. I'm Alexis Del Cid. On the next Morning Medical Update, the ongoing debate over pediatric screening and why some doctors aren't convinced it's necessary. Plus, one extreme example of what happens when a child's cholesterol goes through the roof. Monday at 8 a.m.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stites podcasts. Now everywhere podcasts are available.